Hi everyone, welcome back to my YouTube channel. Today we are going to talk about neonatal versus adult skull. We'll start our topic with introduction, and here at the side you can see the diagrammatic representation of neonatal skull and also the diagrammatic representation of adult skull. Human skull undergoes significant transformation from infancy to adulthood, adapting to the growing brain and maturing physiological needs. The neonatal skull is soft, flexible, and designed for childbirth and rapid brain growth, where the adult skull is fully ossified, rigid, and structurally optimized for protection and function. Understanding these differences is crucial in pediatric medicine, craniofacial surgery, anthropology, and forensic identification. Now let's talk about the first difference, that is ossification and bone development. First we will talk about neonatal skull and then we will talk about adult skull. In neonatal skull, there is incomplete ossification at birth consisting of soft membranous area known as spontaneles. These bones form through intramembranous ossification allowing gradual mineralization over time, and these gaps between the cranial bone remain open to accommodate rapid brain expansion. Talking about adult bone, by adulthood, skull bones have fully ossified, becoming dense and rigid, and the sutures which were flexible during infancy progressively fuse, eliminating fontanelles. The hardest bones provide durability and enhanced protection for the brain against external forces. Now let's talk about fontanelles and sutures in neonatal skulls and adult skulls. In neonatal skulls, fontanelles are soft membranous regions between the skull bone. The major fontanelles include anterior fontanelles, that is largest and located between the frontal and parietal bone. It closes by 12 to 18 months of age. Then the second fontanelle is posterior fontanelles, that is smaller at the junction of occipital and parietal bone, and it closes by 2 to 3 months. Then it has sphenoidal and mastoid fontanelles, that is located laterally, closing early in infancy. Cranial sutures remain widely open at birth, allowing movement of skull plates during delivery and postnatal growth. We are talking about adult skull. In adult skull, fontanelles are absent and all sutures have fused. The coronal, sagittal, and lumbar suture remains visible but immobile, serving as structural joints between the cranial bones. Now let's talk about size and proportion of adult skull versus neonatal skull. Neonatal skull newborn is disproportionately large compared to rest of the body. This is because of the brain is already relatively developed at birth, requiring a larger cranial vault, and the facial skeleton, including the jaw and nasal structure, is much smaller in comparison to the neurocranium. While in adult skull, there is a proportion that are more balanced, with the facial skeleton developing significantly. The mandible and maxilla grow to accommodate mature dentition and facial features become more pronounced. Now let's talk about bone thickness and strength in neonatal skulls versus adult skull. In neonatal skull, the skull bones are thin and pliable, making them susceptible to external pressure and molding. This flexibility aids in childbirth but also predisposes newborn to conditions like plagiocephaly, that is flat head syndrome, due to prolonged resting on one side. Then talking about adult skull, in adult skull's bones are thicker, denser, and more resistant to impact, providing enhanced protection for the brain. This rigidity also minimizes vulnerability to deformation. Now let's talk about skull molding during birth. In neonatal skull, during childhood birth, the soft flexible skull undergo molding, temporarily altering shape due to pressure in the brain's canal. The adoption helps ice passage through the maternal pelvis, and the shape naturally restored within the days through extreme molding may require medical intervention. Then talking about adult skull, molding does not occur in adults, as the skull is fully ossified and incapable of deforming under pressure. Now let's talk about vulnerability to injury and healing in neonatal skulls versus adult skull. In neonatal skull, due to its softness, the neonatal skull is relatively resistant to fracture, as the bone can bend slightly without breaking. However, traumatic injuries can lead to sphenomatomas or subgaleal hemorrhages requiring monitoring. While in adult skull, the adult skull is stronger but more prone to fracture due to its rigid structure. Injuries such as depressed skull fracture or basilar fracture can result from significant trauma, often requiring surgical intervention. Now let's talk about facial bone development in neonatal skulls versus an adult skull. In neonatal skull, the mandible and maxilla are small at birth with minimal dental structures. The nasal passages and orbits are underdeveloped, contributing to a rounded facial appearance. While in adult skull, the facial bone becomes more robust and the jaw grows to accommodate teeth and the nasal cavity enlarged, leading to a more defined facial profile. Now let's talk about conclusion of whole this lecture video. Neonatal skull differs significantly from the adult skull in terms of ossification, flexibility, proportion, and vulnerability to injury. While a newborn skull is designed for adaptability and growth, the adult skull is fully developed for protection and function. Understanding these differences is vital for clinical application including pediatric care, craniofacial surgery, and trauma management. And this was all about differences between neonatal skull and adult skull. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.